Kara Pressman is a 15-year-old with epilepsy, and she needs surgery to fix the problem that she's been dealing with most of her life. But guess what happened? Her health insurance company, Aetna, said no. So credit to CNN here. They did a good job. They had her on. Let's see what they had to say.
How much would this surgery have changed your life? Tell me about what it's like for you to deal with these seizures. They happen to you all the time.
Yeah, I get them, they're very irregular, so I really don't know when I'm going to get them, but I really don't know what it's like to not have them, so I don't know how it's going to impact me when I get the surgery. And
you've been having these, since you were just a little girl?
Yeah, I remember getting them in preschool.
Goodness me. And it gets as bad as you can't see anything. You black out. You shake for up to 2 minutes. It's really invasive. Any 15-year-old shouldn't be having to deal with it. So you found out about this surgery. It was all set to go. Everybody was excited. And to find out, you had 2 words for Aetna when you found out they were denying your surgery. Mom, does she have permission to say it on television?
Oh, sure. Go ahead.
What did you say, Kara?
I said, screw you.
You were really mad, weren't you?
Yeah. I was really disappointed.
And Julie, as a mom, it's really disappointing that what they did approve was a procedure you didn't even request and your doctor didn't even request. They approved a much more invasive and risky brain surgery that is far more invasive. And actually, it sounds like surgeons prefer doing the minimally invasive one and feel it has a much better outcome.
Yes, absolutely. And you don't want to start with the most, physically challenging surgery this would require than cutting open a piece of taking a piece of a skull out, putting a plate in her head. So the laser ablation surgery is 1 day in the hospital, literally 1 day. Success rates for somebody with Kara's characteristics, having the kind of epilepsy she has, mesial temporal lobe epilepsy, she's perfect for laser ablation surgery. And there haven't been just a few done. There have been thousands of these done in the United States, and there's a current clinical trial underway involving dozens of hospitals. I've spoken to many of the surgeons leading that surgery. So, we wanted to start with this and make this as easy as possible.
Here's why this story is so important. It's important because of what she's going through, of course, but it's also important because of all the people who've experienced something like this, but they didn't get a segment on CNN shining a light on it. How many times has an insurance company said, no, we're not going to pay for this thing that you need, or we'll pay for this other thing that's worse, that's more invasive, that you don't necessarily need, because that's the decision we made and that's final. Insurance companies do this all the time. And by the way, they make more money the more they wiggle out of paying for people's care. That's how they pad the bottom line. That's how they make profit. So there's a fundamental structural problem in how for-profit insurance companies work. But the reason why this is such an important and illuminating story is because it shows you something. All the things that people on the right are afraid of about government-run healthcare, about Medicare for all, it's happening right now, and it's happening way worse than it would be under a government system. So they say, oh, we don't want a middleman getting in between us and our doctor, making our decisions for us. That's exactly what this is. This is an unnecessary middleman getting in between somebody and their doctor or somebody and their surgeon, saying, no, I'm not going to let you do this thing that would work and that you need. They're afraid of the government doing that. The government wouldn't do that. They would approve that surgery. But a for-profit insurance company is not approving that surgery. And then also the idea of death panels. You know where there are death panels? For-profit insurance companies. Because they decide oftentimes, no, we're not going to pay out on that surgery that you need, sorry. And then some people die or they go bankrupt, going over the top and having to pay a shitload of money for something that shouldn't cost that much money because they're covered. So for people who are afraid of the government, no, in Medicare for all, countries, in single-payer countries, people like this get that surgery like that. Instead, what happens now is they've approved a more invasive surgery that's more dangerous. They don't want to do that. They want to do the easy one. And the surgeons are saying, no, you should do this one that you didn't approve. So the unnecessary for-profit middleman, that's the problem. The insurance companies are the problem. And by the way, if you're concerned about the cost of this stuff, which I don't know why you would think about that looking at this poor girl's story, But a Medicare for All system costs $32 trillion over 10 years. Our current system would cost $49 trillion over 10 years. So you save $17 trillion by doing a Medicare for All system. You cover everybody. You save money, and you don't have a situation like this where they reject something that is obviously the answer. Aetna should give her surgery immediately. It's the right thing to do. And I don't give a fuck what their reasoning is to why they didn't approve it. They are wrong, and they need to approve it.